And Brian, you're part of the Healthy Cities Network of WHO, and Cork is a designated healthy city. And could you explain what it implies to be part of the network, and also what the key learnings are for Cork City when it comes to climate and health?
Yes, and thank you very much for having me here. I think the discussions that are happening elsewhere in this conference, as you mentioned, will determine some of the global outcomes, and then all the political leaders will need to go back to their home countries and legislate and implement actions at a national level. I suppose what I want to focus on is a city level. So Cork is a city in Ireland with 200,000 inhabitants. And we became a World Health Organization designated healthy city in 2012. And it's been a long journey, and I suppose three of the key findings for those interested in becoming, embarking on this journey of a healthy city would be that you need buy-in. You need buy-in not only from the local politicians, which is essential, but also from the staff who work in the local municipality, because they have to be a champion for this. And they won't always see health as their primary focus or even part of their brief. You also need then co-leadership between the city and the health partners. This extends to the university, health providers, across the board. And thirdly, then, the democratization of the health agenda. So involving citizens, including citizens and communities, and increasing the representation, and adding in a focus on health equity. So those would be the three key learnings, I suppose, from Cork's experience of becoming a healthy city. We're also on the environment and health subgroup of the World Health Organization Europe Health Cities. And that gives a key focus, places a key focus, I suppose, on the linkage between health and climate, which is the topic that we're discussing today. So when you've assembled those different components that I mentioned, well, then you need to develop action plans, inclusive action plans, and have them timed, have them staged so that you can have delivery. So it turns the ambitions, a bit like what Club more broadly in terms of climate change, turning that ambition into actual action.
How did you work to include citizens?
Well, in a number of ways. I suppose what we do have a policy framework that helps to kind of provide an impetus for this. So we've the Health 2020, which is the European health policy framework. We've got Healthy Ireland, which is the national framework. But then locally we have Compass, and this is the Cork Kerry Community Healthcare. And this is really about a local plan around improved healthcare. And what we needed to do then was to ensure that health was incorporated into the various different mechanisms, but the key one in terms of public participation was the establishment of the Cork Public Participation Network. To have an interagency approach that involves representation from community organisations and citizen groups, as well as from the state and public bodies. Also, in terms of the teams, like we now have a new action plan for Cork Healthy City for the 10-year period, 2020 to 2030. And it's effectively centered around 6 themes. People is the first. So again, this focus on citizens and communities, places, peace, prosperity, participation, and planet. So participation is important in terms of the decisions, but then also in terms of the activities. I can give you 3 examples of activities, maybe as well. So we have the Cork Transport and Mobility Forum. So this links in terms of co-benefits, the transport, I suppose reducing the emissions associated with transport and delivering the health benefits from that. So it's about improving the quality of the environment through which people travel, and also broadening accessibility for people to travel sustainably and actively. And also then to change the culture and the mindset towards active travel. So 2 examples there would be a cycle map that we generated and made publicly available so people can navigate the city by bike. And also then a Cork community bike scheme to encourage those who want to use bicycles to be able to repair them, etc. So involving citizens. The second activity focuses on enhancing air quality. And we've seen the co-benefit or the linkages rather between climate and air pollution. We saw the European figure you mentioned. You mentioned the global figure. In Ireland, we have about 1,400 people that a year die from air pollution. And so what we've done there is sort of put in place mechanisms to inform the public about air quality data and health impacts, connect with the university where I work, University College Cork, to monitor air quality data around the city and make that available so people know at different times what is the air quality precisely where they're living. And also then a monthly webinar on the importance of environmental sustainability and health. The final action then is around food, because food, and we've seen with the agriculture, the impacts of climate change on agriculture, but also, of course, as a contribution from our agricultural systems to climate change. So the Cork Food Policy Council has set up a Cork food map, and this includes looking at how food is marketed close to schools to inform parents and children around improved eating habits for health, but also for moving away from fast food. And also then food growing initiatives in urban spaces. You mentioned the green spaces. Part of that is food growing initiatives to connect people with the land, with food, and also encourage sustainable food consumption patterns. So there be 3 examples. Thank you.
I really like the idea of the cycle market.
Yes.
I think that was